Welcome to H4U's brand new talk show. Today is World AIDS Day and we have with us Dr. Shah Dupesh. Welcome, sir.
Yeah.
Welcome to our channel.
Yeah.
So far, you've been in the field for 7 years. So how do you find this field?
Well, the field is very interesting because we get to solve complex problems like male infertility, which is very poorly discussed, and also problems with sexual health. Well, basically men's reproductive health, to put it in the whole gambit of things. And I guess coming to sexual health, because today is World AIDS Day and you're making a specialized program on it, sexual health has not got the care it actually deserves at least in India. And at least from the private health sector, maybe I would put it that way, because the government has great programs on HIV/AIDS awareness campaigns, and there are a lot of HIV drugs are being distributed free of cost in most government hospitals. But I don't think the private sector has done much in terms of industry research or anything there. And it's not just HIV; there are a lot of sexually transmitted diseases, and there's a lot of social context that goes into these things, because today the youth is different. Premarital relationships are okay now, at least for a majority of the people are more open. Alternate family forms are coming, so there are a lot of things which we can address and work towards fixing. Yeah.
So in today's generation we have a lot of variety, like living together and all that, etc.
Yes.
So there are a group of people, they see people who are affected with HIV and AIDS in a very different way. Like you should be something ashamed of, you're like outcast, outlaw people. So what do you say for people like that?
I think there's a lack of public awareness on the issue, because I guess HIV and AIDS has a tremendous social stigma attached to it, and that's simply because how does it spread? Well, if you look at the first reported case was actually in Los Angeles, way back in 1981 in the United States. That's when HIV was first reported. Although the disease originated in Africa, and it was the virus actually grows in the monkeys, actually the chimpanzee species. So we know it's a zoonotic infection. Basically, it was somehow something happened and the infection came from the monkeys to men.
So it's passed on from
it's passed on from it's passed on. God knows how, but it came from the animals to man. And man, the first set of infections were noticed among men having sex with men. Well, basically the homosexually oriented people. And at that point of time, the concept of homosexuality or these kind of relationships were not even accepted. And then later on, what happened, the initial disease which spread throughout the world was because of homosexual contact as well as injecting drug users. So either way, people are also aware of it. So the second anyone says you have HIV or AIDS, people by default you will attribute your sexual orientation, or maybe he's a homosexual, maybe he's a drug user, maybe he did something nasty, or maybe this girl went out with too many guys, or maybe this guy went with too many girls. See, they're not they're not cultured well, they're not good people. That's the social stigma with it. So that's how it goes. It's a long story.
So now actually there is a confusion, like what is HIV and AIDS? So can you clarify the difference between the two?
Yes, of course. Well, HIV results in AIDS if left untreated. So HIV is basically an infection. It's a viral infection, and what the infection does, it compromises your immune system. So how it compromises your immune system is it basically infects a certain cell line in your body called the WBCs, a certain type of cell in that. It's called the CD4 T cell, right? So the CD4 T cell is the body's core cell that plays a very important role in protecting you from a lot of other infections. So when that cell dies down and when the virus kind of establishes in your body, it kills your cells, your CD4 cells, and because of that other infections come in and affect your body. And people die not directly because they get an HIV infection, they die because they get HIV. HIV becomes AIDS if left untreated. And AIDS is an immunodeficiency state. That means all other infections will come in and kill the person. Yeah, so it's very different. HIV can be kept in a latent stage, or let me not put it that way. HIV can be kept under control with certain medications called antiretroviral therapy. So then it doesn't progress to AIDS. So there are definitely different.
So both are curable?
Well, they're not curable. They're treatable. There's no cure for AIDS. Well, at least nothing that has been clinically proven. People are working on stem cell therapy and a lot of new drugs and new treatments, but there's no cure. The only thing we do is we give drugs called antiretroviral drugs,
So
which
the medications that you give is just for a temporary.
Well, temporary. It gives it. Well, it keeps the viral copy numbers really low in the bloodstream, because the virus basically multiplies in your lymphoid tissues. So, what is the lymphoid tissue? That's where these CD4 cells are produced. It's the factories. So, when those factories are killed all around your body, you don't have those workers coming out in your bloodstream and killing and knifing the infection down. So, it attacks the core structure of your immunity. So, what the antiretroviral medication drug does is it basically targets these cells there and kind of keeps them in low numbers. So, then you have a longer lifespan basically. Yeah.
So, how do you find out what are the symptoms, like if you have affected by HIV or AIDS? How do you find out?
Well, it depends on which stage of the infection the patient is in, because well, say if the patient is in an acute phase, right? So that's how HIV infects a person. The patient has a sexual contact, a high risk one gets the disease, and if it's in the acute phase, he may have fever, may have sore throat, sometimes nausea, vomiting, sometimes a rash in the body, diarrhea, weight loss. These are all symptoms in the acute phase. Or lymphadenopathy, that's very commonly seen. What's lymphadenopathy is the same thing. Those factories catch fire and your lymph nodes are all swollen. That's another way of putting it. But if the patient is in a later stage, so what happens, you have this acute phase, and then at a later stage the patient goes into a symptom-free phase because the body is fighting back, and that's called the latent phase, where there's absolutely no symptoms. In some patients you will not even have anything. So it can be a very silent, nasty disease. It's a very silent and a nasty disease. You have to get checked, well, if you want to kind of find out whether you
okay, now you found out you're a HIV AIDS patient.
Sure.
So how frequent should the testing be done with doctors?
You mean if you want me to discuss on the tests? Well, there are two tests which we recommend patients to do. One is called a simple blood test, which uses a technology called ELISA, and this is probably the oldest test, which came in 1992, if I'm right, and it is still exceedingly well proven. It's 99.5% sensitive. So say an individual has had a high risk contact and he is very worried, because today we see a lot of patients who just come for testing because of the fear of HIV. I mean, they are the people who even run to the clinics out of sheer fear. They're so afraid. So you have to wait for 3 months. So you can get tested immediately after exposure. It's going to be negative, but that's a false negative. So you have to wait for 3 months. After 3 months, it checks for the antibodies that are produced against the virus. So it's very simple. If you get any infection, your body produces antibodies. Simple as that. So the test checks for those antibodies, and that's the ELISA test. And there's one thing, if the patient again involves in high, and you have to do it twice, one after exposure, after 3 months again. Say the patient goes again into a high risk sexual behavior and he keeps doing it again and again and again. He has to just keep getting tested again and again till he's very well, till he's sure that he doesn't have.
Will the body be adaptable for
adaptable in the sense, how would you kind of?
I mean, if a person's getting tested and he's quite treated, so it goes back to again for sexual contact. This keeps on happening again.
Oh, he can get infected because it's another partner. Okay. There's always a risk, because if the individual has unprotected contact, he does not know fundamentally from where he is getting the infection. It also depends where the individual is going for contact. So there are high risk areas, every demography, or every, like for example, if you take India and if you take a certain city, there are certain high risk areas where HIV is more prevalent. I don't want to take the place's name, but there are certain areas. So we ask all that, we stratify the risk. Yeah, and whether the patient used protection, whether the patient didn't use protection, all that, and what was the type of contact he had. Did he have, receptive anal intercourse, oral genital intercourse, oral intercourse? There are so many types, and the risk varies. You have to stratify the risk.
Yeah, there's another myth that is it possible by any chance, having direct contact only will cause you into HIV, or even having protection?
Virus usually spreads well in the seminal fluid, the vaginal secretions, also the breast milk. And blood, of course, blood and blood related products. But if protection is used, and normally we advise patients to use, we advise them not to go out and have contact in the first place. That's the first thing we advise. We tell them not to engage in high risk sexual behavior. But if that situation comes, using a double condom is usually quite protective. at least 95% of the time.
Okay. Is there any self-test methods for patients to do in their home itself?
Yes.
To get them checked?
It was self-test method. There's one particular kit. It's called it's a home-based test, and I think it's called the OvaCure detection kit for HIV. And the patients can use that kit. It's based on a salivary swab, so patients don't have to go to the doctor. They can order the kit online. It's an FDA approved kit, by the way. It's US FDA approved. But the problem with the kit is that you have to wait for 3 months to get a right report.
Why is that you have to wait?
Because that's the window period after which the antibodies are produced against HIV. The kit checks for the same antibody. The kit basically checks antibodies produced in your blood for the virus. So say you get an infection, and if the antibodies are not produced in your bloodstream, the kit is not going to detect it. But it's an FDA approved kit. It's very sensitive, but the problem is there's also a risk of something called false negative. That means say I give the test to 100 people. 8 out of 100 people will show negative in the kit, but the joke is they would be positive, so that's a false negative. So you have to follow it up with further testing.
So
Confirmatory.
is there any specific process, like it should not, the kit should be kept only in this place, it should not have any sort of specific procedure for this?
Procedure? Well, no, nothing like that. It's a home kit, so you can buy it online, and there are a lot of companies coming out with lots of kits, but you just have to see whether it's FDA approved, and all you need is a salivary swab. The kit usually carries the instructions, so it's very easy to do.
So since you said
The
it's
reading.
for 3 months,
Yes.
so it's like, okay, today if I'm using one,
Yes.
afterwards should
If you have contact again,
yeah,
then
store
you
it,
might as
where
well.
do I store it? Just keep it in an open place, or like how does that work?
Oh no, it doesn't have to. The reading is given in 20 minutes
Okay.
with a color change
Okay.
of positive and negative. You don't store it. You have to buy more kits for more readings. It's a one use, one time disposal based. Yeah. So,
which age and gender is basically affected with HIV/AIDS?
well, I think it's mostly the youngsters. Well, people as soon as they come into puberty, people go into flingy relationships. So starts from as early as maybe 18 all the way up to 35 and maybe even 40. But gender is a very relative statement, because that the gender disparity in AIDS, in HIV infection rates or incidence rates is very variable place to place. So I would say men more than women, and because why men more than women? Because men tend to seek out multiple sexual partners. Women don't do that. Women look only for emotional attachment. So there is an inherent drive there. And here's the other thing. The seminal fluid is more infectious than the vaginal fluid. It harbors 10 times the quantity of the HIV virus compared to, of course, but both sides has been reported. Like women also infect men, but it's probably men who infect men, men who infect women more.
So
It's more like towards the
population?
it's probably more towards men. So as compared to women in our country, if you look at our country, most of the women are victims of HIV. They are the true victims. It's the men, you got to get back at them anyway. Yeah.
So like when it comes to the population, like percentage of men and women, which is the highest?
It should be about maybe around 60-40 or maybe 70-30 should be the range. Men, women, yeah. 70 men, maybe 30 women. It's always more on the men, that I'm very sure. Yes.
Is there any lifestyle routine for patients affected with HIV/AIDS?
Well, lifestyle routines, the only thing patients have to remember is they have to take their antiretroviral medications, because the medication is what keeps them alive. In the absence of medications, the patient survival is low. There have been reported studies where patients, when monitored properly and given antiretroviral drugs long enough, they live for 25 or even 30 years. And that also involves taking care of your general health. I mean, walking, regular exercise, eating food that's good for your immunity, like lemon, ginger, amla, all these things which are actually very, very good for your general systemic immunity. Amla is actually very good.
What about meat?
Meat is good. You can take meat, but you should restrict the carbs. That's very important. So anything that's very good for your immunity, and taking care of your general health. You don't want diabetes, hypertension, cardiac problems, because you already have HIV. And if you have HIV, you're already, not in a very happy state of life. So you have to take care of your general health and treat infections that can come and go during the course of the infection, because that's what HIV does. It will progress to AIDS one day or the other. There's no stopping that. But how it kills a person is because of other infections coming in. So patients with HIV will get tuberculosis somewhere 5 years down the line, or will get fungal infections, or will get some form of cancer. So that's the whole thing. So they have to take care of that.
Is there any, in case if patients, if they skip or accidentally they forget to
Yes.
take the treatment once or twice, so what is the risk factor later on?
Well, I don't think, patients shouldn't skip, because the second they stop antiretroviral medication, you see, how we monitor a treatment is basically we look at the viral load. We look at the number of viral particles in the bloodstream. We also monitor the CD4 count. These are the only two things that we look at while treating patients. So when you skip, the viral load shoots up very high. So you can't take that risk. And then sometimes what happens, the virus mutates and the drug is no longer effective. Then you have to go to other drugs. And drugs can also have side effects. So drugs can have side effects like nausea, vomiting, rashes. It's very hard on the patient. So I think most patients who are adequately counseled, most of the time they don't take that risk of skipping. Yeah.
So is there any suggestion for you?
Suggestion?
Do you want to say for
Yeah, I think the only suggestion would be is there are a few facts. So we know for a fact that HIV spreads when men have sex with men. HIV spreads when you share needles and drug use. HIV spreads when you become sexually active very early. So it's interesting because adolescent girls who use OCPs have a higher risk of contracting HIV. And adolescent girls who use OCPs are usually sexually active. That's why they're using the OCPs.
adolescence means what is age?
Somewhere between 13 to 21, maybe 13 to 18. Women, girls. So they're very susceptible because it's interesting because their vaginal epithelium is not developed. So the virus is able to go right there and infect them. So what's very important is engaging in a relationship with anyone, you probably want to first use protection. You don't want to abuse drugs. You want to get married really early, and you want to keep your sex drive under control, be it a man or a woman, because man, it's not worth it once you get it. So that'll be the social message. Yeah.
Thank you so much.
Yeah, thank you. Yeah, thank you.